Thank you. It is an honor to stand before you at such a momentous occasion in your collective lives. You all know how much dedication and sacrifice went into bringing you to this moment. And you also know how much of the dedication and sacrifice was not your own, but that of family, some of whom are here today, and others who, for reasons of mortality or distance, may not be here. I share their pride in your accomplishment. This is a brilliant tradition, pausing to be reflective before entering the next phase of your training, transition to clinical practice. If you pay attention in life, you'll notice that there aren't as many opportunities for reflection built in. You'll have to find them for yourselves. Seek stillness and quiet. Look back so that you can more clearly look ahead. I stand before you as a physician, an expert in a rare and life-threatening condition called pulmonary arterial hypertension. But more importantly, I stand before you as a patient. You see, it's possible to go through all of this incredibly well-curated training and still emerge not really understanding what it means to be sick. I know I came out of my pulmonary and critical care fellowship not truly understanding what it meant, not understanding what my patients needed from me and what I in turn needed from them. Fortunately, I had the chance to die. On the final day of my critical care fellowship, because of course the universe understands irony, an arterial tumor burst in my liver, and I lost my entire blood volume into my abdomen. My liver failed, crushed by the weight of the massive bleeding. I had a stroke due to the lack of blood flow to my brain, and my kidneys shut down from the hemorrhagic shock. As toxins began to accumulate in my bloodstream, my heart began beating aberrantly and then not at all. In the operating room, I heard them say, "We're losing her." And I remember thinking, I think you're right. In fact, if I can see myself on the table, perhaps I'm already lost. I felt weightless, buoyant even, small, and yet so expansive, as if I were part of everything all at once. The devastating pain that had brought me to the hospital was gone, and I felt completely at peace. 2 weeks later, I would find myself dying again. I had only just barely survived that first night. The baby I was 7 months pregnant with did not survive. It strangulated from the lack of blood flow. When they closed me that first night, they actually closed the fascial layers with a kind of suture they refer to as a whip stitch that they normally reserve for funerals or autopsies. So 2 weeks out from that first catastrophic night, I was in the surgical ICU. I had come off the ventilator, but my respiratory status was still precarious. My kidneys had failed and fluid kept reaccumulating in my lungs. I was alone in my ICU room. The nurse had laid me flat and then left to get something that she'd forgotten. Left flat, my heart rate accelerated and my oxygen saturation plummeted. My alarms sounded, but they were always sounding, and at that point had lost meaning. We all had alarm fatigue. My vision tunneled, and I attempted to breathe into my lungs, which felt as sodden as soaked sponges. My arms flailed, and I knocked the call light onto the floor, effectively eliminating that option. As I began to lose consciousness, I saw above me, like a beacon, the code blue light. I pressed it. The room filled quickly with confused, albeit engaged, providers who, while they wondered aloud who had called the code, simultaneously went about inserting drainage catheters into the space around my lungs, tubes into my stomach, supplied me with high-flow oxygen, and allowed me to breathe again. Amazingly well-choreographed interventions that were literally life-saving. And yet when they went to leave, I found I didn't want to let them. I asked them, could we please talk about what just happened? One of them turned and explained to me that I had reaccumulated a pleural effusion, that they had drained liters off my lung, that it had effectively been drowning me. But that wasn't what I meant. My question was not a request for data. As doctors, we so often believe that every question is a response for data. It's how we're trained. It's far harder to decode the emotion encoded in the question. It's far harder to recognize fear and respond. I wanted to talk about how I had nearly died, twice now, for those of us who were keeping track. It felt as if we should be talking about it. At that point, having completed my critical care training in an active tertiary care hospital, I had probably participated in or run hundreds of codes. I had never once, not ever, considered talking to a patient about their mortality, their near death, or their emotions about it. Why? Because medical training, if we're not incredibly careful, will teach us that that is not where our value lies. That our value lies in knowing the answer when asked. Our value lies in solving difficult problems. We've memorized and codified mountains of medical content. You've learned the nerves and arteries of the brachial plexus, the difference between nephritic and nephrotic syndromes, so that when asked, it was accessible and accurate. We work hard at that. It's a gratifying and enviable position to know the answer when asked. You will go on to learn so much more. And as you do, you may be shocked and saddened by the indignity of illness. You will see terrible, difficult things. And you will learn to approach these diagnoses methodically, with intellectual curiosity, and a clinical distance. A large part of our training as physicians is spent learning to diagnose and treat diseases. It's what we study. We are not as well trained to see the people burdened by the diseases or to recognize and tend to emotion. That poor doctor had no idea what I was asking of him. And to be fair, I don't think I knew what I was asking of him at the time. I knew why my kidneys had failed. I knew why I was in respiratory failure. But I didn't understand why. I entered the hospital as a physician. I left weeks and weeks later in a wheelchair, having had a stroke. I was missing important words, some of my favorite words, like shoes, no longer accessible to me. I was unable to even put on socks unassisted. I couldn't walk more than a few steps. I had to completely reimagine my identity. That was a gift. The wound is the gift. In the empty space where I no longer existed, I had the opportunity to truly evaluate what medicine had given me and what it didn't have to give. We all want to be seen, to have our lives reflected back to us in a way that brings meaning. It's especially important in times of chaos, critical illness, but it's a very human need. It's why we turn to literature and art when we want